know prostate exams are essential, colonoscopy essential. What else should men in their 50s and 60s get tested or screened for?
So at this age, or in this age range, is where unfortunately a lot of chronic conditions begin to get diagnosed. And when I say chronic conditions, I talk about the things that are typical and that are common that we hear all the time: hypertension, diabetes, cholesterol, obesity, all of these chronic medical conditions, and if psychological stuff as well, depression, and we can't forget about the importance of mental health. All of these things are screened for in your annual examination. And as we prompt and ask you and do tests, these are the chronic conditions that we're looking for in this age range, which you, again, may be completely asymptomatic or may be unaware, or somebody in your organizational structure of support system may be more aware of. Again, sleep apnea, a very important thing to really question, and I think is under recognized, absolutely.
And what kinds of health screenings can a man do on his own?
Well, simple things like checking your blood pressure and, of course, weighing yourself and paying attention to your calorie intake is something that we can do. The amount of energy, and when I say energy, I mean calories, the amount of calorie intake and energy that a 55-year-old man needs based upon his activity compared to an 18-year-old male patient is different, correct? So it's hard to convince this 55-year-old that he shouldn't eat like he ate when he was 18, and trying to temper the nutritional intake. Unfortunately, we're fighting against the food industry. The food industry doesn't recognize your age when you walk into the restaurant. So they're not going to serve you an age-appropriate portion. They're going to serve you a portion. So
I'm sorry, you're too old. We're going to have to take some of those mashed potatoes back. Yeah.
Right, correct. Well, that obviously wouldn't be necessarily a good business plan for them.
No.
But recognizing, it's on us. It's on us to recognize that, okay, the amount of energy, the amount of calories that I need to feed my body needs to be smarter, needs to be more effective, and it becomes a better strategy. In other words, it has to match the energy requirements, and the calories in, calories out becomes very, very important.